Hi everyone, my name is Lilu from Complete K Health. Today I would like to talk to everyone about a condition we call carpal tunnel syndrome. Carpal tunnel syndrome, also known as median nerve compression, is a collection of signs and symptoms caused by inflammation and degeneration of the median nerve at the wrist. Internationally, the incidence of carpal tunnel syndrome is reported as approximately 2.5 cases per 1,000 subjects per year. Females at the age of 45 to 60 years are more likely affected by this condition. Carpal tunnel syndrome is characterized by numbness and tingling sensation at your hand and forearm. These symptoms are typically localized at the first four fingers as well as the distal palm. They're often accompanied by an achy pain at the back of the wrist in this area. And some patients may also complain about swelling, sweating, and changes in skin temperature in their hands. It can be quite uncomfortable. Now, you might ask, what causes these symptoms? Scientific research shows that the median nerve can be irritated and damaged by medical conditions that cause swelling at the wrist. These conditions might include water retention from pregnancy or menopausal, thyroid dysfunction, diabetes, hypertension, sometimes rheumatoid arthritis, and even fractures and trauma to the wrists. Carpal tunnel syndrome can also be aggravated or worsened by certain movements, especially repetitive or prolonged extension of the wrists. These movements might include prolonged positioning for typing and using mouse, prolonged exposure to vibration, such as using a jackhammer, and lastly, repetitive extension of the wrists, for example, playing piano and playing video games. You might be curious, how physiotherapists diagnose carpal tunnel syndrome? The answer is from your subjective history and by performing physical examinations. We will ask you when and how the symptoms started. We will also check for symptoms, signs of tenderness, swelling, and any forms of deformities at your wrist. We might also check your grip strength, your finger sensation, and some certain wrist movements. In some cases, if the above assessments are not conclusive, a nerve conduction study might be required to confirm the diagnosis. How do we treat carpal tunnel syndrome? Treatment for carpal tunnel syndrome depends on the severity of the weakness and symptoms. The current guidelines recommend treating carpal tunnel syndrome without invasive interventions if possible. So some of these non-surgical options include, first, using splint for your wrists to avoid positions that overextend your wrist, especially at night. Following activity modifications to avoid tasks that triggers the symptoms. Commencing exercise programs that maintain and improve your wrist strength and muscle length. And lastly, taking mild medications to reduce pain and inflammation, such as non-steroid anti-inflammatory medications. In some cases, steroid or cortisone injections can be used to reduce pain and inflammation, allowing patients to engage in their rehab programs more effectively. Treatment of underlying medications can also be helpful, and bear in mind, surgery is only recommended if there's very severe damage to the median nerve. Lastly, but also importantly, how long does it take for carpal tunnel syndrome to recover? According to the current evidence, approximately 90% of mild to moderate cases respond well to conservative management, which means these patients tend to show noticeable improvement in about 4 to 6 weeks. Unfortunately, some other patients with underlying pathologies such as obesity, arthritis, and fractures to the wrists might suffer more from the condition, and they tend to have less favorable prognosis. I hope our video helped you in your condition, and do not hesitate to comment, ask questions, or call in to talk to one of our physios.